Well, good afternoon and welcome to another edition of Business Basics. My name is Lee Iben. I'm the firm owner here at Action Coach Campus. And with me today is Eric Turner with Jet Physical Therapy, and kind of a fascinating story. So first of all, Eric, thank you for joining us. I appreciate it.
Yeah, I'm glad that you welcome me and interested to have a conversation with you.
That sounds great. So you are located in Washington. That was your first location, but you have two locations. But you've been doing it for a while. You're not a newbie to this whole physical therapy gig by any means. Kind of give us the backstory. How'd you get into it?
Sure. So, in high school, I had a couple athletic injuries that required some physical therapy, and I was fortunate with the physical therapist that I worked or that provided the care for my injuries. Was very helpful and kind of mentoring and guiding me toward pursuing physical therapy. And Interestingly enough, my wife, who we went to high school together, also had a similar interest.
Mhm.
And so we kind of took different paths to get to the same, reach the same goal. So when I finished my undergraduate degree at the University of Iowa, I started working for an individual named Pam Hazel. And after 2 years, I got accepted into the Master's of Physical Therapy program at the University of Iowa. And prior to that, my wife was going to school and getting her Master's of Physical Therapy at St. Ambrose University.
Okay.
So we had about a 4-year stretch where we were trading off working, going to grad school, starting our family.
Mhm.
And just kind of things just worked out very nicely that we could both transition to work here in Washington. And after about 6 or 7 years, we have an opportunity to buy the practice from Pam Hazel, and she was fantastic and guiding us and making the transition pretty seamless.
That's great.
We've tried to keep things on the tracks since.
That's right. Well, so you and I share a lot of interesting dynamics that we don't hear of too often. Working with our spouses, I did that for 20 years. My wife went back and became a pediatric dentist, and I owned the business with her. I was the business
Okay.
manager.
Gotcha.
And then high school sweethearts. I mean, my wife and I went to high school together as well up in Northeast Iowa, and just kind of said, let's be in business together. So those are interesting dynamics
Right.
when you work with your spouse and you've known her for so long.
Right. Yeah, it's initially we started out as coworkers treating patients and providers, providing patient care. We've since kind of diverted a little bit. Jennifer has more of an administrative role now here, and then provides patient care in a different fashion for a different company in a different setting, and kind of just so happened that worked out best when we were raising our family and our kids were all at home.
Absolutely.
And so we just kind of continued with those roles, and it seems to be working most of the time.
You don't really think about it going into it when you go into business with your spouse, but you realize pretty quickly that you each have to have an area of expertise, and you have to rely on, even though you have a very different opinion,
Right.
that let that one go because he or
Right.
she, that's their area, right?
Right. Yeah. And after 20 some years, we kind of know where the lines are drawn, and helps keep conflict at a minimum.
It does. Not eliminated always, but at least at a minimum.
Right.
We always, we would get into discussions at times about how the business portion of the dental practice would overlap the patient treatment portion. And because we were pediatric dentists, we always defaulted to the patient treatment area. But
Right.
we had over 20 years, we had probably more than one discussion about that. So.
Sure. It was probably all healthy and helped the practice evolve.
It did, absolutely. And we're still married today, so it's all good, right? But you learn very quickly when you
Yeah.
do things like that.
Yeah.
So tell me about that succession, how when you purchased the business from the previous owner, what kinds of things did you look for, or how did that previous owner help set you up for success?
Well, I think first and foremost, she was a good role model in um, being involved in the community, um, having the serving the patients first, as you kind of just alluded to, was important for the practice. Um, we had good staff that was here, and they were all experienced and understood kind of the operations, just the day-to-day operations, and what their role was. I think the hardest thing for my wife and I was just, you know, being able to handle the business side as well as continuing to have the same role as a healthcare provider. We didn't have any business training,
Right.
in physical therapy school, so we were kind of learning on the fly at times, and we had to make some adjustments just in personalities, like some structural organizational things. Just and as we learned, what worked for us and our personalities, that just continued to evolve. But um, the previous owner, she was very supportive and, very excited for us and the opportunity that we had. And, that I think was helpful in terms of the credibility for our existing patients to continue their care.
Mhm.
And that, she had trusted us to take over what she had built. And, patients then recognize that, hey, they're still going to get a good service here, even though she was no longer located here, providing care. So we're very fortunate in that respect. Um, just a good role model and the credibility that she entrusted us with, I think, with the community.
That's fantastic. And there was a kind of that weaning off period for her. I'm assuming that, to give her patients the confidence to hand them over
Right.
to you and your wife at the time. Um, and now since then, you've grown your staff. It looks like you have a total of 8 folks, in addition to a front desk person at the Washington location, and then it looks like a couple of physical therapists up in Wellman,
Right.
front desk person there as well.
Right. So over the 20 years, there's been a lot of changes in physical therapy profession, just like most other professions, and there's more care provided within our community and the surrounding communities that we serve. For example, we started, there was no physical therapist at Halcyon House or
Hmm.
the UP home that was providing services to and on kind of an outpatient basis, and so that's changed, and so we've had to make some adjustments and change who we're trying to uh, reach and serve. And
Mhm.
we have been able to grow the practice. We have 3 physical therapists that are full time here in Washington, 1 in Wellman, and then we have a staff person who splits their time between the 2 clinics.
Okay.
We provide a lot of sports medicine services to the area high schools,
Mhm.
and we have 2 athletic trainers, full-time athletic trainers, and that's really grown and continues to grow each year. And there's a lot of benefits, both um, to sports medicine practice, and then it's just this kind of supplements what we offer from a physical therapy standpoint, getting our name out there to a little bit more reach
Right.
further away from Washington. And then we have a couple other individuals that help us out with some of those sports medicine services. They have a full-time job. For example, we have one person who's a teacher, and then she helps, on the nights and weekends.
Oh, great.
So we're very fortunate that we can have established some connections and can try to serve as many schools that are needing those services.
Absolutely. And you probably put a lot of weight into referrals, I would guess. Um, I know 95% of our patients came from referrals, word of mouth, or other practitioners who would refer children over to our practice. In fact, it kind of got to the point to where I didn't want to advertise, generally speaking, like in the newspapers and things, because we had such a wait list to get in. It would have been more of a disservice to schedule
Right.
them. It'd be a 6-week or longer wait to get a new patient in.
Mhm.
And I imagine in your business as well, you've got a good referral base.
Yeah. So there's a lot of similarities, a little difference from kind of the dental or physician model. Um, so our practice is 95% referral as
Mhm.
well, referral from providers. So most often, if someone has some low back pain or had shoulder surgery, they're being referred from, either their primary care provider or maybe a specialty physician such as a surgeon. Um, we do see that other 5% from direct access where they come in on their own. Hey, I've got this issue with my ankle. Um, is this something that you can help me with? So our care, the difference um, from more of the dentist model is it's usually we see people for an episode of care, they're done with that. Maybe they never need another episode of care, or maybe they need several. Just to kind of depends on their, with their health situations arise.
Right.
Whereas, with the dental model, there's patients that are coming in, let's say every 6 months for a cleaning, then something arises. Physical therapy is just a little bit different in that nature. So we do have some patients who have multiple episodes of care, but sometimes they only need us one time. So, that we cycle through differently. And um, yeah, it's just kind of a different, but we definitely rely on the referrals, and we've got great support both locally from, the physicians and um, nurse practitioners, physician assistants that here in Washington, and then from those specialty physicians, say the orthopedists from University of Iowa or Steinler Clinic in Iowa City. We see a lot of referrals from those two sources. We have some great connections, and very grateful for the support that the different providers allow us to mutually treat their patients.
That's fantastic. That's great. So 21 years, you learned a few things along the way, right? Talk to me about what some of your business, and honestly, most of the folks that I work with in my area are just like you. We start off with a skill and we want to monetize it. We love what we do, but now we say, how can I do this more often and actually support my family? Fair enough, right?
Right.
But then we jump into it with no business background, and then we learn kind of the hard way, the school of hard
Right.
knocks, right? So
Right.
tell me about some of the lessons that, or a lesson or something in your memory that you would want to share with another new business owner, just something that
Sure.
stuck right out.
Yeah. I think for us, finding the right fit of employees
Mhm.
um, has been an important factor. Um, a lot of our providers, but not all, are from the area and have returned to the area, raising, been married, raising their family. They're likely to, be here for a long period of time, and we can um, put resources into training them and growing their skills. Um, and we're fortunate that we have had a couple people that aren't from nearby area, and um, they have enjoyed the Washington community or one of the smaller surrounding communities, and we've been able to, in a similar fashion, help them grow professionally. But having kind of the same characteristics, um, same kind of values in terms of the way we serve our patients. I think that's really important. And then, as I said, showing that we value them and providing them with support and the training that they, feel like that they're being able to grow and becoming more competent and more skilled, and we've kind of done that in a teamwork fashion. And we take once a month and devote some time to some training, and we talk about where is it that we need to shore up and some of our skills and knowledge, or as things evolve and change, something new comes up, and we'll have maybe a physician come in and speak to us about some new trends and how that's changing, for example, knee replacement surgery, and then therefore how do we change in our care. So I think that we've seen that our staff has really appreciated that, and if they feel appreciated, they're going to work hard, and they feel comfortable, and them feeling comfortable, I think, is in their surroundings and that they're valued, I think, really important. And the longer that they're here, then they start developing their own patients that want to return and see them if they have another episode of care.
Yep.
And that then allows us as owners to be able to diversify how we spend our time. We don't feel like we have to be treating patients all the time. And then, okay, how can we, as a business administrative issue comes up, we take care of it at the time, that we can be more proactive and kind of try to foresee the future a little bit, stay in a more even keel basis, and not being just reactive to things.
Not putting out fires.
Right.
We don't like that, Eric. We don't like to put out fires all the time.
That's right.
We don't really like putting fires at all if we don't have to.
Right.
I love it. Yeah, what you touched on was so accurate, especially in today's economy and post-pandemic. We hear more and more about how the millennials, the Generation Zs, they need to be shown love and appreciation for the work that they do, even if they're quote unquote unskilled. They're fresh out of high school, they want to get a job, work at the grocery store across the street from you or something, and we just have to show them appreciation, show them value. But you're stepping it up a notch, and even those who are skilled that have gone on to become physical therapists, no matter what level they're at in our organization, everyone at their core wants to know that they're appreciated. And how do we show them that appreciation is so key. It really is.
Yeah, absolutely.
That's great. Well, thank you for sharing that.
Yeah.
All right, I won't keep you any longer. Let me just wrap this up real quick.
Okay.
Our special guest today, Eric Turner with Jet Physical Therapy, 2 locations. The larger one's down in Washington, second location over in Wellman. If you need physical therapy, please reach out to Jet Physical Therapy. Talk to Eric. He's got a great staff over there. Great place. I stopped in a couple weeks ago. You won't be disappointed. So Eric, thank you very much. Don't go away, Eric.
Okay. Thank you.
Yeah, thank you.